Well, it's a dire situation in Jefferson County ICUs tonight. There are no beds available. More than half are currently filled by patients battling COVID-19. In total, 175 COVID patients are in Jefferson County hospitals. This pandemic can sometimes feel like a numbers game as we track the cases, hospitalizations, and more.
But each number is somebody's mother or father, their teacher, their friend. Today alone, 214 were newly diagnosed. Certainly testing has evolved dramatically since the start of the pandemic. And now you can find out whether you have COVID in a matter of minutes. That's if you know where to go to get tested. At the beginning of the year, there were testing sites on almost every corner around town. We saw them in parking lots and outside big stores.
But now, Southeast Texans feel like they're having to hunt for testing spots. 12 News reporter Cameron Seibert joins us live tonight with this search for testing sites. So, Cam, what you find?
Yeah, Dej, Jordan, the big topic of conversation with the fight against COVID-19, of course, has been vaccinations, but health officials are also stressing the importance of getting a test. Just when it felt like the coast was clear,
almost eradicated, we were like, man, it is gone, like it ain't nowhere here.
The Delta variant created a new surge.
And it just almost overnight flipped right around 4 weeks ago, and it has not subsided since.
By now, you've been told to get vaccinated. But we can't forget about getting tested if we feel symptoms. One way is to schedule an appointment at a local CVS or Walgreens by heading to their website, finding a location, and selecting a time. Right now, the wait list is 2 days out. Or you can go to a walk-in clinic like Best Med Urgent Care in Lumberton, Vidor, and Port Arthur.
It's testing the patients to know if they're spreading this virus or not, and definitively, is this just allergies or is this COVID-19 that I have, And unfortunately right now, most of the answer is yes, it is COVID-19 with a lot of our patients.
In the last 4 weeks, Best Med Urgent Care has administered 3,000 tests with 850 positives, meaning just under 30% of tests are coming back positive.
So before, we were such a limited supply, we were trying to, not just test every single person walking in just to minimize the supply of it, but now we have such an access to it that it really isn't an issue.
One other major consideration when it comes to picking a location for a test is, of course, insurance. At a private location like Best Med here, you are going to be required to have insurance. Meanwhile, at a place like CVS, there is federal aid for folks without insurance. But for now, reporting in Vidor, Cameron Seibert, 12 News.
Good information there, Cameron.